Hey everyone, and welcome back to the Pharma Mind. In our last video, we left off at the most dangerous moment in the story of atherosclerosis, plaque rupture, that can lead to a heart attack or stroke. But what if we could intervene right at that critical moment? Today, we're exploring the heroes of this story, antiplatelet medications. To understand how these drugs work, we first need to understand our target, the platelet. When you get a cut, platelets rush to the scene, stick to the injury, and form a plug to stop the bleeding. Think of platelets as the body's tiny 24/7 emergency repair crew. They're essential for survival. But in atherosclerosis, when a plaque ruptures, it exposes materials from inside the plaque, like collagen, that platelets mistake for a severe injury. This triggers an emergency response. That means the platelets become activated. They change shape, get incredibly sticky, and release chemical signals to call for backup. It's a chain reaction, creating a rapidly growing clot or thrombus that blocks the artery. This is thrombosis. So, how do we stop this? The first and most famous antiplatelet drug is aspirin. Inside every platelet is an enzyme called COX-1. Its job is to produce a powerful chemical called thromboxane A2. This thromboxane A2 promotes the aggregation of platelets, making platelets stick together. Low-dose aspirin works by permanently blocking that COX-1 enzyme for the entire life of the platelet. By blocking COX-1, aspirin reduces thromboxane A2 production. Now, platelets are less sticky and don't clump together as easily and form clot. This is why it's a cornerstone of preventing heart attacks and strokes. But there's more than one way to silence the alarm. Platelets also use a second key communication system. When activated, they release a molecule called ADP, adenosine diphosphate. ADP acts like a messenger, binding to a specific receptor on other platelets called the P2Y12 receptor. This binding tells the nearby platelets to become active and join the forming clot. This is where our second major class of antiplatelet comes in. Drugs like clopidogrel, prasugrel, and ticagrelor are P2Y12 inhibitors. They work by blocking that docking port. If ADP can't bind, the platelet activation chain reaction is interrupted. Often, especially after a heart attack or placing a stent, doctors use both aspirin and a P2Y12 inhibitor. This is called dual antiplatelet therapy, or DAPT. It's like tackling the problem from two different angles for maximum effect. By making platelets less sticky to prevent harmful clots, antiplatelet therapy also reduces their ability to form beneficial clots when needed. The main side effect and risk of all antiplatelet therapy is bleeding. It's a constant balancing act between preventing a heart attack and causing a major bleed. So let's recap. When platelets get the wrong signal from a ruptured plaque, they create a dangerous clot. Antiplatelet drugs like aspirin and clopidogrel step in to silence those signals, keeping our vital arteries flowing. They are a powerful tool in our fight against cardiovascular disease.
If you found this video helpful, please subscribe to the channel and hit the bell icon to make sure you don't miss the next one.